I want to now go to Carmen, who you combine credit programs with healthcare and training, and I'd like you to tell us a little bit about what you're doing in Bolivia.
Okay. First of all, thank you very much, Mr. Secretary. Thank you to be able to participate in this wonderful conference, and to Mr. President Bush and his wife to host us here and to bring us together, to think together and learn from each other new ways to fight poverty. As a co-founder of Pro Mujer Microfinance, as a co-founder of Pro Mujer, a microfinance institution for development that began its operations in Bolivia 17 years ago with a very strong mission to be a developmental tool to fight against poverty. We began with very, very poor women that were living with donated food, and they thought they couldn't do anything else but receive donated food. We began working with them to develop programs that will help them achieve a development in their lives and to be actors of their own development. When we began, the only thing that they were asking was for donate things. And they discovered and they helped Pro Mujer to find ways, and we have witnessed firsthand how microfinance, together with services that give them access to the education and health, will bring them out of poverty. We have seen how they increase their business, how they increase their income, how they do improve their health, their education, not only for themselves, but also for their children. For example, in Peru, a recent study showed that Pro Mujer clients earn 20% more than non-clients, and that they invest the money that they do not only to improve furthermore their business, but they do use their income to give health services to their children and to their...
How many women do you reach with your organization?
As a whole, we're over at 200,000 clients around in the 5 countries where we operate. In Nicaragua, for instance, our clients didn't have a chance to have a cancer exam. Now all of our clients have pap smears, and they receive treatment when they have a problem. In Argentina, we have 4,000 clients. It's our newest country. In Argentina, with the 4,000 clients that we are working with, now they have access to medical care, and most of them, for the first time, they have access to dentist care. In addition, all of our clients in the 5 countries where we offer our service are able to save. They have savings which they thought they never would be able to save.
And so you're encouraging, there's an educational component, a financial literacy component to this?
Exactly. When we give this, we prove by giving them access to financial services, together with training, together with financial education, they're able to invest the loan that we give them in an income generating activity that assures that is a capital seed, that they're going to use it over and over, and they're going to improve the quality of lives. We truly believe, as Kofi Annan has said many times, that the best way to break the poverty cycle is to invest in women's empowerment and education, because it trickles up in the education of their children and in the community. So we think that having a very strong microfinance institution is not enough. You have to show the return, the social return of the microfinance institution in order to be able to claim success. If you are not able to show the changes that you're doing in the community that you're working in, the families that you're working, and in the women, investing in women, it has a wonderful effect in achieving development.
Right. So a big part of what you do is get results and measure those results and make it clear.
Exactly, in a permanent way. We are very rigid in having a very, very well-run microfinance institution in one hand, but in the other hand, we have very rigid measurements if our clients are doing as well as the institution.
Very good. Well, we're going to move along because we want a chance for all of us to have a chance to speak.